Hey, I'm Dr. Ashley McInnes. I am a chiropractor, a performance therapist, and active release provider. What does that mean? A lot of people have some preconceptions about what a chiropractor is. Traditionally, chiropractors do work on the spine. But I wanted to just clarify a few things about what I do, because I often run into people where they tell me about shoulder injuries or ankle injuries or tennis elbow injuries, a variety of different injuries where they have sought other providers and other care. And that is totally fine, and I understand that. There are many different ways to treat different injuries and different conditions. But I just wanted to let everyone know that follows me, they might not know what I do exactly. So I have a lot of extra training in sports injuries and sports chiropractic. Performance therapy is where there is a combination of feedback from athlete, coach, and therapist in order to optimize and improve performance. And they all give feedback to try to push that forward. And that deals strictly with human performance and dealing with sports injuries. And oftentimes what happens is I'm working on hips and shoulders and knees and a lot of other things other than the spine. And so I think what's really important to get out there is that through various techniques like active release techniques and gua sha, like fascial scraping techniques, shockwave therapy, other kind of myofascial techniques, as well as chiropractic manipulation and adjustments, let everyone know kind of what I do. And when they have an injury to the nervous system, the musculoskeletal system, that someone like myself should be actually one of the first people that they contact, because we are one of the few people that can actually give an appropriate diagnosis, as well as go ahead and give that therapy based on that diagnosis right away. And we also have some of the highest amount of training of all of the kind of physical medicine practitioners. Our education is very similar to medical school. We go to school for the same amount of time. We don't necessarily do a hospital residency, but we do an outpatient clinic residency and a lot of extra training like that as well. Now, one of the things that I wanted to also let everyone know is a lot of people don't like to see doctors. A lot of people don't like to see practitioners, especially in the queer community. And they may not feel comfortable. They may feel like they're not heard. And one of the things that I really work on is try to make sure that I'm listening to patients. I have their best interests, first in mind. And I would like to provide for them a safe space and a place where they can feel comfortable, not judged, and where they can get the best kind of care, because quite regularly in the queer community, we don't always get the best treatment or the respect that we deserve. So I want to make sure that people in the queer community know that I can provide that, and I'm here for them. If people have a hard time accessing care, there's also other options. Please contact me. We can try to make something work for everybody. A lot of people have fear about getting chiropractic care. A lot of times that has to do with neck treatment and cervical manipulation. Yes, I do that, but it doesn't mean I have to do that with you. So there are many different techniques, like I've already mentioned, active release techniques, different mobilization techniques that don't involve high velocity manipulation. Doesn't mean we have to do that. In fact, I don't do it with a lot of people, especially initially, because of the amount of soft tissue work that typically needs to be done. And active release techniques is a little bit different than what, say, massage therapy or something like that would offer. So don't let fear of a certain technique in treatment prevent you from getting really top quality care. I have a lot of experience with some of the top athletes in the world in MMA, in kickboxing, in rugby, in football, in soccer, Canadian football, and then football, soccer, and as well as CrossFit, ski racing, many different sports, many world champions, high-level athletes, a lot of experience working with them, and I try to translate that to everyday use and giving the average person or the recreational athlete the type of care that those elite athletes get. That's one of the things that I really pride myself of, is being able to give the everyday person or the everyday athlete the type of care that some of the top athletes get in the world. So I really enjoy doing that, and especially to the queer community where, again, they're underserviced and they often don't get the highest quality care. So if you have any questions, please feel free to contact me through my social media, and I would be very happy to have a consultation with you, answer any questions, and hopefully see you in the office soon. Thanks.